Yeah, great. That is a great point. That is an excellent question. Ticks can spread multiple diseases, and there can be these co-infections with other pathogens as well. So when a horse is exposed to ticks or they get bitten by a tick, they're not only being exposed to the Borrelia, which is what causes Lyme, but the ticks can carry more than one organism, and that means the horse can sometimes be dealing with co-infections or these overlapping tick-borne disease patterns. The big one we think about in horses the most is anaplasmosis. This tends to look more acute than Lyme because you see fever, depression, limb swelling, stiffness, reluctance to move, or even mild neurologic signs like incoordination. And unlike chronic Lyme type cases, anaplasmosis often responds really quickly when it's treated appropriately by a veterinarian. So other tick-borne organisms like Ehrlichia or Bartonella or pyroplasmosis organisms like Babesia, they can come up as well, but they're not as equally common or as well established in the research in horses as anaplasmosis and Lyme. The more of that research is seen in humans and dog research. But it's important to know that the reactions to ticks can come from multiple organisms. And sometimes Lyme is part of the picture, sometimes it's exposure without actual disease, and sometimes there's other tick-borne infections as well. And sometimes the horse is just left with inflammation, immune dysregulation, pain, and poor recovery, regardless of which organism caused it. The research data on horses is not as robust as on humans and dogs, but there are tests for most of these, and you should discuss them with your vet if you suspect something or if your horse is exhibiting these kind of symptoms. Of course, treatment varies on each of these co-infections. But I will say that this is where integrative medicine really shines. So the antibiotics or the other meds for the co-infections are necessary in acute disease. Most owners have horses with chronic patterns and they're kind of left with not a lot of options. This is definitely a topic that we do a deep dive on in the Hale and Hardy Horse Collective. So if this kind of information interests you, please come join us there. Right now there's a wait list because I'm working really hard behind the scenes to kind of get all this together and hold down my regular job and everything. But there is so much coming together and I'm really excited for this platform.